I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. For many people, the pandemic has resulted in far more screen time than usual. How might that affect our eyesight? This is the People's Pharmacy with Terry and Joe Graydon.
You've no doubt heard that the eyes are the windows to the soul. We can't prove that, but exciting research shows that the retina offers researchers a way to examine the brain and its overall health.
There have been some important advances in medications for macular degeneration and glaucoma. Cataract surgery has also changed.
We'll get the latest updates on eye treatments from one of the country's leading researchers.
Coming up on the People's Pharmacy, how your eyes reveal your health.
In the People's Pharmacy health headlines, Chile is an unexpected leader in vaccinating its population. Its health ministry reports that almost 87% of eligible adults are fully vaccinated. That puts it near the top of countries worldwide, just under Qatar and Israel. The Chilean success is attributed in part to an early start and a culture that embraces vaccination. The country has a history of well-organized vaccination campaigns that they bolstered with 1,400 new sites and a readily accessible national scheduling system. Public health authorities negotiated contracts with several different vaccine suppliers so that they would not be reliant on a single manufacturer. They're already vaccinating children over the age of 6 and will soon be giving booster shots to people over 55. Although Delta has made inroads, the country is beginning to see decreasing rates of COVID infections.
While public health authorities have been focused mostly on COVID-19, another virus is making inroads in many parts of the country. Mosquitoes carrying West Nile virus have been identified in most states. Human infections have been recently reported in Massachusetts, Arizona, Connecticut, Idaho, North Dakota, Utah, Louisiana, New Hampshire, Texas, and Delaware. There's no vaccine or treatment for this infection, which can attack the nervous system. Symptoms include fever, stiff neck, horrible headaches, confusion, nausea, and rash. Preventing mosquito bites is the best protection for this potentially lethal disease.
For decades, physicians and nutrition experts have been warning Americans to choose skim milk instead of whole and cut back on cheese. The idea was that full-fat dairy products would raise cholesterol and lead to atherosclerosis and heart disease. As a result, low-fat yogurt dominates the shelves at most grocery stores. Does sticking with low-fat dairy lower cholesterol levels? A randomized controlled trial recruited 72 individuals with metabolic syndrome. This condition is defined as elevated blood sugar, high blood pressure, a big belly, and abnormal levels of cholesterol and triglycerides. Researchers assigned the volunteers to a diet containing less than 3 weekly servings of skim milk or 3 servings daily of either full-fat or low-fat milk, yogurt, and cheese. After 3 months, there were no differences in LDL, HDL, or total cholesterol. Triglycerides and free fatty acids were also unaffected. The scientists conclude, therefore, dairy fat, when consumed as part of complex whole foods, does not adversely impact these classic CVD risk factors.
What causes obesity? Most health professionals blame overweight on an imbalance between calories in versus calories out. In other words, eating too much and moving too little. This concept is known as the energy balance model, but a new perspective published in the American Journal of Clinical Nutrition calls that idea into question. The authors recommend research to see whether the carbohydrate insulin model fits the evidence better. Consuming highly processed, quickly digested carbs kickstarts insulin production, which results in fat storage. In theory, then, the brain senses inadequate energy for other tissues, triggering hunger and leading to overeating. If the carbohydrate insulin model is correct, not all calories are equal. People might need to cut back on highly processed carbs to break the cycle.
Experts have been debating the health benefits of omega-3 fatty acids found in fish oil. A new study found that supplementing the diet with EPA, but not DHA, improves cognitive performance in healthy young adults. The investigators recruited 310 volunteers to receive either EPA-rich oil, DHA-rich oil, or placebo oil for half a year. Objective tests showed that those taking EPA improved their global cognitive function. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Have you spent a lot of time lately staring at screens? The pandemic has forced many of us to communicate with one another online instead of face-to-face. That means Zoom meetings, webinars, Skype calls, and FaceTime. How are your eyes holding up?
I, for one, have noticed that when I spend a lot of time staring at my iPad or typing on a laptop, my eyes get tired. Our ancestors spent far more time outdoors looking at the horizon or observing nature.
Researchers have found that children who spend more time outside are less likely to need glasses for nearsightedness. A new study of kids in Hong Kong found that rates of nearsightedness doubled while schools were shut down because of the pandemic.
Today, we're talking about how to keep your eyes healthy. Our guest is Dr. Sharon Fekrat. She is professor of ophthalmology and associate professor of surgery at Duke University Medical School. She is associate chief of staff at the Durham VA Healthcare System. Dr. Fekrat has been director of the Duke Vitreoretinal Surgery Fellowship Program and director of ophthalmology faculty career development. She is currently director of Duke iMind Research Group. Dr. Fekrat is the editor, along with Dr. Tanya Glazer and Dr. Henry Fang, of All About Your Eyes.
Welcome to the People's Pharmacy, Dr. Sharon Fekrat.
Thank you so much for inviting me. I'm really thrilled to be here and looking forward to speaking with both of you.
Dr. Fekrat, Dr. Shakespeare, William Shakespeare, said that the eyes are the windows to the soul. But I think a lot of our listeners would be surprised to learn that our eyes are the windows to our overall health as well. So I wonder if you could share a little bit about the research that you've started regarding Alzheimer's and Parkinson's disease by looking at the retina. I mean, is it really true that you can see what's going on in the brain?
Yes. So, we think that the eyes are the windows to our soul, and they may also be the windows to our overall health, including our brain health. And so there's been a lot of work in the literature over many years regarding this, but this really came to light, so to speak, in my clinic one day several years ago when I was examining identical twins who were 96 years old. And so identical twins, as we know, they have the same DNA, and so they have the same genes and genetic makeup. However, what was very striking to me is one of them had advanced Alzheimer's disease, and the other one was cognitively very healthy and intact, using a smartphone, talking about political events, and driving a car. And I knew right there and then that this was an incredible opportunity to examine their eyes and study the differences in the retina and the optic nerve, which are extensions of the brain.
And did you see differences in their eyes?
Yes, we did. It was a very interesting and striking difference. So we found decreased retinal vessel density. So the blood vessels in the retina of the identical twin with Alzheimer's disease was markedly less than the twin who was cognitively healthy. And that started all of it for us.
Well, that is an extraordinary story. We're going to come back to your research in a little bit, but I've been hearing that it's possible to actually see changes in the cornea when people have long COVID. Have you heard anything about that?
So, the eye has been something that has captivated a lot of us during this COVID-19 pandemic. It started with concern about the tears and whether viral particles were in the tears and could be transmitted through the tears. And looking at and knowing that COVID can result in decreased smell and decreased hearing in some individuals, we know that the virus is affecting the brain. And since the retina and the eye, including the cornea and the corneal nerves, are extensions of the brain, we are currently, as a profession, studying the optic nerve and the retina and the cornea and how that is affected in people who are long haulers or have recovered from COVID and continue to have sequelae or consequences from having been infected.
Well, it's perhaps really important that researchers will be able to help identify long COVID and maybe help us come up with treatments. But let's go fast forward to some of the other conditions that can be detected through a careful eye exam and why an eye exam is so very important. What are some of the health conditions that ophthalmologists can see through the eye?
Yes, well, there are a long list of conditions that affect the entire body that can be sometimes detected and diagnosed through a careful dilated eye exam. And the reason is that in the retina of the eye in particular is numerous blood vessels. In fact, some of those blood vessels are some of the smallest in the body. They are 5 microns in diameter, which is not even the width of a human hair. So we can look in the eye and we can see evidence of hypertension or high blood pressure that affects the blood vessels.
What's the signal that someone has hypertension? What are you seeing in the retina?
So it depends how high their blood pressure is and how long it's been elevated. So in somebody with long-standing hypertension that's treated pretty well, we may see what we call silver wiring. So the arteries are normally these beautiful red, juicy looking blood vessels, right? And with long-standing hypertension, they can be narrowed and not as red, a little more silvery. We also see if someone has what we call malignant hypertension, instead of 120 over 80, maybe 210 over 150. We might see splotches of blood and little what we call white cotton wool spots, which are areas that are damaged from the high blood pressure.
What about diabetes? Can you also see that through the window of the eye?
Yes, we can. In fact, diabetic retinopathy, screening for diabetes as well as detecting diabetic retinopathy and treating it is some of the bread and butter that retina specialists in particular do, which is a type of ophthalmologist. But all eye care professionals can look in an eye when it's been dilated and can see a variety of things in eyes with diabetes. I think a very important message is that you can have raging diabetic retinopathy in the eye, which is potentially visually threatening and have no symptoms. And so that's why regular examination of the eye in anyone with diabetes is critically important. But when the small blood vessels in the body are damaged from hyperglycemia or high blood sugar, they close. And when they close, we don't know how to open them. But what the eye does, it responds by growing new blood vessels. And you think, gosh, that's terrific. My body can heal itself. But actually, these new blood vessels that grow in response to closed blood vessels in the retina from poorly controlled diabetes are not good. And they're like weeds in the garden, and they grow and bleed and scar and can cause visually blinding, difficult to treat problems.
What about things like high cholesterol or heart disease, thyroid problems, or even something like Lyme disease?
Yes. So all of those can be manifested in the eye in different ways. High cholesterol by itself, unless it's very high, like a total cholesterol of 600 or 700 instead of the normal 200 or less. Sometimes when it's that high, instead of the blood looking red in the blood vessels in the retina, it can look a little more milky or yellowish. But that's exceedingly rare. But sometimes we'll see a piece of cholesterol that looks like a gold nugget stuck in one of the blood vessels in the retina. And that means it had broken off from one of the larger blood vessels in the body, like our aorta in our chest or our carotid arteries in our neck that can get cholesterol buildup. A chip can break off and travel in the bloodstream and go right and left and make a U-turn and end up in the retina. And that can be a clue that the cholesterol is too high. Lyme disease actually doesn't initially manifest in the retina. That's something that is more advanced stages of Lyme disease and can manifest as inflammation. And so really these are great examples of how the retina and the eye are windows to our systemic health.
You're listening to Dr. Sharon Fekrat. She is professor of ophthalmology and associate professor of surgery at Duke University School of Medicine. She's currently associate chief of staff at the Durham VA healthcare system. Dr. Fekrat has been director of the Duke Vitreoretinal Surgery Fellowship Program, director of ophthalmology faculty career development, and is currently director of the Duke iMind Research Group. She's the editor, along with Dr. Tanya Glaser and Dr. Henry Feng, of the book All About Your Eyes.
After the break, find out how often you should see the eye doctor.
Age-related macular degeneration affects a lot of people. What is it, and how is it treated these days?
What symptoms are an early red flag for age-related macular degeneration?
Ophthalmologists sometimes recommend vitamins for people with AMD. What's the story on AREDS?
We'll also get the latest on cataract surgery and choosing replacement lenses.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is supported in part by CocoVia, now offering its new cardio health product with 500 milligrams of cocoflavanols. This 100% pure CocoPro cocoa extract formulation is backed by 20-plus years of research on cocoflavanols.
Cocoflavanols increase the body's output of nitric oxide to improve endothelial function, which results in enhanced blood vessel flexibility and better blood flow. More information at cocovia.com. Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon.
The People's Pharmacy is brought to you in part by Kaya Biotics, organic probiotic products made in Germany, KAYA Biotics.com.
Also by CocoVia, now offering its Cardio Health Powder with 500 milligrams of cocoa flavanols. More information at cocovia.com.
How is your vision? When you have to read fine print, do you struggle? What symptoms should prompt a visit to the eye doctor?
Did you know that migraines can manifest as a shimmering change in vision? It may not have anything to do with headaches.
Age-related macular degeneration is a common cause of visual impairment. Treatments for this condition have changed dramatically over the past several decades. Are dietary supplements at all helpful? In addition, how has cataract surgery changed over the last few decades? How do you determine the best lenses for your situation?
We are talking with Dr. Sharon Fekret. She is professor of ophthalmology and associate professor of surgery at Duke University Medical School. She is associate chief of staff at the Durham VA Healthcare System. Dr. Fekret has been director of the Duke Vitreoretinal Surgery Fellowship Program and director of ophthalmology faculty career development. She is currently director of Duke iMind Research Group. Dr. Fekret is one of the editors of the book, All About Your Eyes.
Dr. Fekret, we understand that somewhere around 21 million people in this country have vision problems, and they range from nearsightedness or even presbyopia to things that are more serious, cataracts, glaucoma, age-related macular degeneration. In order to detect problems with our vision, how often should we be seeing an eye doctor?
Well, that is an excellent question. So the eye exams that are recommended really vary on how old the person is. So, vision screenings are generally performed, in the first year of life, and those are screenings, not necessarily a full eye exam. And then between the ages of 3 and 5 years old, really before first grade, they're also sort of screened when they go to the pediatrician's office. But then over the age of 5, more formal eye exams are recommended so that the actual level of visual acuity can be measured. And then in adults, pretty much from 18 to 40 or so, and with no known eye problems, usually a comprehensive eye examination, including dilation, every 5 to 10 years is really fine if no one's having any symptoms or doesn't wear glasses. But if someone has diabetes, for example, or known health problems, then more frequent eye examinations are recommended. And then once a person hits 40 years old, we recommend full eye exams every 2 years. And then once we hit 65 years old, since the incidence of eye diseases increases with age, we recommend every 1 to 2 years in some cases.
During the pandemic, I suspect an awful lot of people, including a lot of children, are using screens. I mean, they're relying a lot on tablets and phones, and they're staring at screens for hours and hours. And I'm just wondering how that kind of intense usage is affecting our vision.
Well, that has been a very thoroughly discussed question that there's a lot of research into. And so there's 2 comments I wanted to make about that. So in children, recent research has shown that being inside, and that includes being on a screen and the near work and looking at things up close, being inside with the near work for prolonged periods of time may contribute to the development of nearsightedness. And so now there are recommendations that children should actually go outside, get some sunlight, and also look off at a distance periodically to help perhaps prevent the development of nearsightedness and the need for glasses correction for nearsightedness. That is not specifically related to the blue light that comes from our screens and our computers and our phones. This really ties into what we were talking about the eyes and our systemic health. There is some thought and discussion and research going on right now about blue light and screen lighting and how it may affect our hormonal balance and how it may affect hormonally delivered or hormonally driven cancers, such as breast cancer and prostate cancer. And so that is very fascinating to me. But the eyes themselves don't seem to be harmed by screens and screen time in adults.
Now, I had a really weird thing happen a couple of years ago. I saw a shimmering light move across my eye, and I panicked, and I went to my eye doctor right away, and he said, "Oh, nothing to worry about. It's a kind of migraine, a visual migraine aura. It'll go away in about 20 minutes. And sure enough, it did. Subsequently, it's happened a couple of other times. How common is that, and is it worrisome?
Yes. Interestingly, ophthalmic migraines or eye migraines are relatively common, and they don't always have accompanying pain. So, as we know, headaches and migraines, we associate that with head pain, but ophthalmic migraines often don't have any pain. But it's a blood vessel spasm in the retina that gives you those visual phenomenon that you describe of flashes of light, different colors, shimmering, and they last 10, 20, 30 minutes at most, and then they completely resolve.
Nothing to worry about.
Correct. Almost always nothing to worry about.
Dr. Fekret, I think that there have been some important changes in treating some serious eye conditions. I would love to have you tell us about age-related macular degeneration. What is it, and how has the treatment changed over the last decade or so?
Yes. So age-related macular degeneration, we call it AMD, is most common in individuals over 65 years old. It is more common in women, people who smoke, have high blood pressure, blue eyes, have a lot of exposure to ultraviolet light or sunlight, and sometimes it runs in families. We don't actually otherwise know the precise cause, but when it does develop, it usually develops in both eyes, and it starts out with what we call the dry macular degeneration, where there are age spots that have accumulated in the central vision of the retina that we call the macula. So it's age-related, 65 years and older, macular, because it's the macula of the retina, like the capital of the state. And then it's a degenerative process, so age-related macular degeneration. And it starts out as dry, which means 90% of people with the dry macular degeneration don't notice any significant change in vision. Now, 10% can convert to the wet kind of macular degeneration, where abnormal blood vessels, different from the abnormal blood vessels that can grow in diabetes, but abnormal blood vessels grow under the macula and under the central vision of the retina, and they can bleed and leak and scar. And the treatment of this wet macular degeneration is where we've had incredible progress in the last 15 years with regards to our treatment. And so the modern day ophthalmologist nowadays has quite a few treatments at their disposal to treat effectively with fairly low risk eyes with wet macular degeneration in order to either stabilize or improve their vision.
I suspect it's really important for people to get into the eye doctor at the earliest signs or symptoms, what should people look out for as a potential early indicator of macular degeneration?
Well, when both of our eyes are open and there's a problem in one of our two eyes, not everyone notices that. And so I think that periodically, while we're waiting for the microwave or waiting at a stoplight, we all should cover one eye and then cover the other and make sure the visual acuity and the vision is unchanged in each eye separately. So we all should monitor the visual acuity or our vision out of one eye at a time and not with both eyes open. But with macular degeneration in particular, if something is brewing, you may see distortion. You could look at a straight line like your blinds or the edge of a doorway or the reading material that you're reading. And you may see distortion, spots that are missing, spots that are blurred out. We generally tell people, though, anything that they don't think is right or normal for them, they should come in and call us and let us discuss it with them and examine them and decide what is exactly causing that change.
How is macular degeneration treated?
Well, for dry macular degeneration, we currently recommend no smoking. We recommend the consumption of dark green leafy vegetables, particularly in individuals who are not taking blood thinners. We recommend sunglasses and perhaps a hat to protect from ultraviolet light, and really just healthy living. There are also now, from the National Eye Institute of the NIH, there are some vitamin recommendations for dry macular degeneration. And so this is in addition to a multivitamin. There are special formulations that are out there and available that are recommended to take on a daily basis for individuals who've already been diagnosed with dry macular degeneration. These are not to try to prevent the development of macular degeneration, but these vitamins do decrease the risk of the dry type of macular degeneration converting to the wet kind by 25%, based on a long-term study done by the National Eye Institute.
So this would be the AREDS formula, is that correct?
Yes, it is called the AREDS, AREDS 2 formulation.
Dr. Fekrat, I'd like to know about cataract surgery because my eye doctor says, yep, you're due. One of your eyes has pretty clear signs of cataracts, and I'm getting close. I suspect that cataract surgery is now considered highly routine, almost production line, but there are a variety of lenses that have become available in recent years. Can you give us a quick overview on how cataract surgery has changed and how the lenses may have changed?
Yes. So first and foremost, cataracts cannot be prevented. Maybe wearing sunglasses can help prevent the growth, but cataracts grow with age, eye injury, eye surgery, and some medications. So cataracts are cloudy lenses. So we are born with a clear lens in our pupil, and with age, most predominantly, they become cloudy. And so in the past, we would wait for a cataract to ripen, so to speak, and then cataract surgery would be recommended. But now, cataract surgery is recommended if you're having trouble seeing, to do what you need to do every day because of the cataract and either the decreased vision or the glare or the halos that are resulting from the cataracts. Now, cataract surgery has, like many other things in the field of healthcare and medicine, cataract surgery has become much less invasive than it used to be in the past. And what I mean by that is the incision has gotten much smaller. Nowadays, we rarely put a stitch or a suture in the cataract wound because it's so small now. And then the equipment that we use and the cataract machine that we use has improved tremendously. So some cataract surgeons have added something called the femtosecond laser to perform select steps in the cataract surgery, which may make certain steps a little bit safer. And the cataract machine has also become much more fancy. It's sort of like driving a fancy car that almost drives itself. It has lots of bells and whistles to make the cataract surgery quicker and safer.
What about the lenses? How have they changed in the last decade or two?
Yeah, so in the beginning, when cataract surgery was first performed, there were no lens implants that were put in the eyeball to replace the cataract lens that had been removed. And in the past, very thick, what we call Coke bottle glasses used to be used. But then we developed lens implants that are put in the pupil where the cataract was. And those lens implants back in the day, really, we only had one or two choices, and they corrected for distance vision mostly. But nowadays, our selection of lens implants have just exploded. We have so many options to correct for distance and near, to help correct for certain kinds of astigmatism. So there are many options nowadays to choose from, and can be a fairly lengthy discussion with your cataract surgeon to decide what best fits your lifestyle and your needs.
You're listening to Dr. Sharon Fekrat. She's professor of ophthalmology and associate professor of surgery at Duke University School of Medicine. She's currently associate chief of staff at the Durham VA Healthcare System. Dr. Fekrat has been director of the Duke Vitreoretinal Surgery Fellowship Program, director of ophthalmology faculty career development, and is currently director of the Duke iMind Research Group. She's one of the editors of the book All About Your Eyes.
After the break, we'll talk about glaucoma and how treatment has changed over the last decade or so.
Which eye drops are most helpful?
Are there special techniques that make it easier to get the maximum benefit from your eye drops?
Dry eyes may seem like a minor complaint, but they can affect the quality of your life.
How useful are immune-modulating eye medicines?
What constitutes an eye emergency that should send us to the emergency department?
We'll also find out how the eyes can offer information on neurodegeneration, like Alzheimer's disease.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. KAYA Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The 3 available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's KAYA Biotics.com. Use the discount code PEOPLE for $10 off your first purchase. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon.
The People's Pharmacy is brought to you in part by CocoVia, now offering its Cardio Health Powder with 500 milligrams of cocoflavanols. More information at cocovia.com.
And by Kaya Biotics, organic probiotic products made in Germany. KAYABiotics.com.
Have you ever had trouble getting eye drops into your eyes? Sometimes it can be hard to get the medicine where it belongs. We'll find out if there are any tricks of the trade. In addition, we'll learn how our eyes may be windows to the brain.
We are talking with Dr. Sharon Fekrat. She is professor of ophthalmology and associate professor of surgery at Duke University Medical School. She is associate chief of staff at the Durham VA Healthcare System. Dr. Fekrat has been director of the Duke Vitreoretinal Surgery Fellowship Program and director of ophthalmology faculty career development. She is currently director of the Duke iMind Research Group. Dr. Fekrat is one of the editors of the book, All About Your Eyes.
Dr. Fekrat, we wanted to ask you about another serious eye condition, glaucoma. Here again, it's more common, I believe, among older people. What is it? What does it do? How do we treat it?
Yes, glaucoma has been something that we discuss among ourselves quite a bit. But in general, glaucoma is high eye pressure that is too high for the health of the eye. And that eye pressure can damage the optic nerve of the eye, which then in turn can slowly affect the peripheral vision. And it can take away the peripheral vision if the eye pressure is not kept low enough. So for glaucoma, it is prevention. Keep the eye pressure low, because vision that is lost from glaucoma cannot be regained. So it's very important to keep those eye appointments and use the eye drops.
Well, the eye drops have changed dramatically. When I was in graduate school, I think beta blocker eye drops were sort of the name of the game. Today, we have some innovations.
Yes, we sure do. We have a long list of eye drops that can be used now. So if a beta blocker eye drop is not working very well to lower the eye pressure, we have a fairly long list, and we classify them all by the color of the eye drop top of the bottle. But we have many eye drops that we can go through before thinking about laser or glaucoma surgery.
Dr. Fekrat, there are some common eye problems. They may not be very serious, but they are bothersome. Can you tell us a bit about pink eye?
Yes. So pink eye we call conjunctivitis, and it can be caused by a virus, even the COVID virus, bacteria, and sometimes chemical related. So pink eye, when it's caused by a virus or a bacteria, can be contagious. And so washing those hands and being careful not to touch the eyes or share towels and bathroom items is very important when somebody has pink eye.
What about dry eye? I suspect an awful lot of our listeners often wake up in the morning feeling that, their eyes are, sand under them and just really uncomfortable. Are there any eye drops we should avoid and any that are especially helpful?
Yes. Before you even use eye drops, hot, moist compresses really help open the pores at the base of the eyelashes and really improve the tear film to keep those eyes moist when you blink, And there are so many eye drops available over the counter without a prescription that we call artificial tears to help relieve the dryness that can result when someone has dry eye. And those artificial tears come in a wide variety. There are watery artificial tears, and then there are slightly thicker artificial tears like a gel, and then there's an artificial tear ointment that often is used before bed. And so I think that those kind of dry eye drops that get the red out, so to speak, we don't recommend those for dry eye.
Now, what about the immune-modifying drugs that are now being advertised on television? They're prescription only. How effective are they?
Yes, so currently we have 2 eye drops that are available by prescription to treat dry eye. One is called Restasis and the other one is called Xiidra. And, you know, it really depends on the individual. One often works better for some individuals than others, and sometimes it's a little bit of trial and error.
Dr. Fakret, a lot of people have to put eye drops in their eyes, whether it's because they have glaucoma or because they have dry eyes. And for me, it's virtually impossible. I am always going to blink, and the drops are going to go here, there, and everywhere, and not in my eye. Is there any secret, any strategy to get eye drops in your eye?
Yes, some of the things that I recommend are number one, you can refrigerate your eye drop so when it does hit your eye, you know it's in there. Another option is to have someone help you. So you could, you have to wash your hands, of course, but you can tilt your head back and then that person can hold down your lower lid. Sort of if you put your finger near your eye, you can feel your bony rim underneath. Just pull it down and then with your eye look up and then squeeze that bottle and get it in. Or you can just, if it's just you, lay down on your bed and you can put the edge of the eye drop bottle right on the inside of your nose or of the side of your nose and just squeeze it and let a drop fall from the side of your nose down into your eye. I do tell my patients if they're not sure they got the eye drop in to do it again.
Dr. Fakrat, what I would like to ask right now is, are there any eye symptoms that should send us straight to the emergency room? What constitutes an eye emergency?
Well, any sort of eye injury constitutes an eye emergency. Loss of vision in one eye. Often people will say, I must be tired, and they'll lie down first, and then critical time is passing. So if vision is lost in one eye, straight to the emergency room. If there are flashes of light or new floaters, straight to the emergency room. If there is new sudden onset of double vision or a droopy eyelid, straight to the emergency room in an adult.
Dr. Fakrat, now we want to turn to your research because I'm really excited about the possibility that you might be able to detect and diagnose brain conditions long before they start to give us cognitive symptoms. So would you please describe what you and your team have discovered?
Yes. So over the last 4 to 5 years, we have built an incredibly large multidisciplinary team at Duke that we call iMind, a small I and then mind. And we are set up in the Duke Memory Clinic, and we are interested in collecting multimodal or many different kinds of images of the retina and the optic nerve in the eye. And we are actively studying those images to try to see if we can diagnose Alzheimer's disease, mild cognitive impairment, Parkinson's disease, frontotemporal dementia, Lewy body dementia, multiple sclerosis. We are looking at all of the neurodegenerations to ultimately try to be able to use these eye pictures to diagnose these conditions really earlier before symptoms start in the example of Alzheimer's disease. Because we know that over the last 10 to 15 years, many clinical trials that have been studying new treatments for Alzheimer's disease have not been successful. And we're not really sure why that is, but it's possible that one explanation could be that the Alzheimer's disease was too advanced at the time of clinical trial entry. So we ultimately hope that being able to easily and inexpensively screen for and perhaps pick up Alzheimer's disease with eye pictures before the symptoms start. We may then be able to enroll these individuals into clinical trials studying new therapeutics and maybe identify some effective treatments. So, it's not ready for prime time. It's not something where you can walk into your eye doctor's office and get some pictures and ask if you have signs of early Alzheimer's disease, because there's many conditions that can imitate some of the findings that we're seeing in individuals with Alzheimer's disease. So there is much more work to be done, but we are a very motivated team and have made some really interesting progress and findings of, decreased retinal vessel density and decreased, thickness of several layers in the retina that we're seeing in individuals with cognitive impairment from Alzheimer's disease.
What do you think is actually going on in the eye that is allowing you to see neurodegeneration in the brain? And that would be perhaps not just Alzheimer's disease, but some of the other dementias and perhaps even Parkinson's disease.
Yes. So, the brain and the eye share many commonalities in their development. And so there have been quite a few post-mortem studies and animal work showing that changes that are going on in the brain are also going on in the retina of the eye. And so our work so far has been what we call cross-sectional. It's been a moment in time. So we're unable right now to determine if our findings are the cause or the consequence of Alzheimer's disease. But as we now are collecting longitudinal data and we're asking our study participants to come back, a year later, 2 years later, we're going to be able to look at the changes over time, and that will be very insightful as we go forward.
If you were to look into your crystal ball and consider the findings that you've come up with already, where do you think this research will lead in terms of neuroscience and Alzheimer's disease in general? Do you anticipate that you might come up with some new theories, some new modeling, some new ways to pursue what is such a devastating condition?
Yes, very much so, because looking at the microvasculature, the very small blood vessels in the retina, and knowing that that mirrors the changes in the brain, because we're not able to look at the small blood vessels in the brain, we are going to be learning about the pathophysiology and what is happening in individuals with Alzheimer's and what is going on in the brain in Parkinson's as we study the retina and the retinal layer thicknesses, which is the structural neurodegenerative changes, and then also the microvascular changes. So we are going to learn a lot over time, a lot more about what is happening in the brain in these conditions over time. And very exciting to us is we are collaborating with the data science individuals and the artificial intelligence or AI health group at Duke to use the images that we're obtaining to train a machine learning algorithm, which is a type of artificial intelligence, to be able to detect changes in individuals who are cognitively normal and individuals who have Alzheimer's. And we have published some of our work already and have some very exciting things going on. So in the future, I think that we may one day, take a picture of our retina with our smartphone, send the images up to the cloud. We'll have a machine learning algorithm that may assess it and then kind of spit out on the other end a risk score or a percent risk, similar to our lipid profile. Our cholesterol profile gives us our risk score for developing a heart attack or heart disease. we would have something like that for Alzheimer's. And that's very exciting.
Dr. Fekrat, as we come to the close of our time with you, I'm wondering if you can give us an idea of what we should all be doing to keep our eyes as healthy as possible.
Yes, I think a healthy diet and not smoking helps maintain our eye health. Having regular eye exams, as we discussed earlier, if you have systemic health issues such as diabetes or high blood pressure, to take very good care of those, because they obviously can affect the eyes, as we had discussed. And then when working out in the yard, or depending what your job is, to wear eye protection. Eye injuries can happen on the golf course, out when you're fishing, playing with grandchildren, walking or running around the house with a fork, fireworks. So really protecting your eyes from injury is a very important thing to do.
Dr. Sharon Fekrat, thank you for talking with us on the People's Pharmacy today.
Thank you so much for inviting me. It was a pleasure.
You have been listening to Dr. Sharon Fekrat. She is a professor of ophthalmology and associate professor of surgery at Duke University School of Medicine. She is currently associate chief of staff at the Durham VA Healthcare System. Dr. Fekrat has been director of the Duke Vitreoretinal Surgery Fellowship Program, director of ophthalmology faculty career development, and is currently director of the Duke iMind Research Group. She's the editor, along with Dr. Tanya Glaser and Dr. Henry Fung, of All About Your Eyes.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
The People's Pharmacy is brought to you in part by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
And by CocoVia, the maker of high-potency cocoflavanol supplements that support cognitive and cardiovascular health. More information at cocovia.com.
And by Kaya Biotics, probiotic products made in Germany from certified organic ingredients. KAYA Biotics.com.
Today's show is number 1272. You can find it online at peoplespharmacy.com. You can subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning. You might want to share it with a friend or family member.
If you'd like to make a comment about this show, look for the post on our website, peoplespharmacy.com. Again, it's show 1272.
At our website, you can sign up for our free online newsletter to get the latest news about COVID-19 and other important health stories. By subscribing to our newsletter, you will also have regular access to our weekly podcast and find out ahead of time which topics we'll be covering. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.